My work with the World Health Organization started in 1963, and that was in Africa. My first assignment was in the malaria eradication program in Uganda, Africa. And from there I went to Nigeria and Zanzibar. There were all malaria eradication programs, and after that I went over to the smallpox eradication program. The smallpox eradication program started in Kenya in 1968, and I was very happy with that because I saw the dreaded disease, what it looked like among the communities and the populations in which I worked, how people were dying with such punishment from the disease. Consequently, I felt very energetic to work hard and to go into the field with my team to vaccinate people and to prevent the disease from spreading by isolating people. This continued and until about 1975, when the disease was eliminated. The smallpox was eliminated from Kenya, and that made me very, very happy indeed and gave me the drive to continue in that program. So from there I was sent to India, where there were thousands of people dying by the wayside, dying by the train tracks, all suffering again from this dreaded disease, smallpox. Again, we started our vaccination program to protect people from getting the disease, and those who had the disease, we isolated them so they could not spread it to others. After that, we succeeded in reducing the disease to the lowest levels. When we get at that stage, it was so difficult that we had to find 1 or 2 sporadic cases which were kept hidden in many homes. And so we had to have spies and people in the community who belonged to the community to tell us where they saw the cases, because if we didn't know where the cases are, we couldn't protect some of the people who would go to visit them. Once we found a case or cases in a home, then we go there and we make sure we immunize the people in the home so that they could not get the disease from the particular patient or patients that they had in the home. In addition to that, we protected the whole environment, the neighborhood, because if that person comes out or if people visit that home, they were also exposed and could contract the disease. In so doing, we managed to get rid of the last remnants of smallpox in India. And from there it was to Bangladesh, where we repeated more or less the same strategy. However, again, that country, women were not allowed out very much. And so once they had the disease, they were hidden and locked up in their houses. So we had to find means of getting to them. And so many women were employed in the program to identify where these women were and where they were suffering in order to go in and assist them and assist their families and prevent them from getting the disease. When we got to the last stages of the disease, which is always the most difficult to eradicate, we had to carry pictures around and go to the marketplaces where people gather in large numbers and to the schools and ask, by showing the picture of a case of smallpox, if that person had seen anybody who looked so infected that their face looked with all these rashes. And once they looked like that, please take us to where the people are. So when we went there, we were able to find the case and consequently isolate the case and protect the environment. In so doing, we were able to eliminate smallpox from that part of the world where the last cases occurred. So the last cases occurred in Bangladesh and in India, and from there WHO pronounced World Health Organization that we had eradicated smallpox from the world, and that disease will not be a burden anymore. After that, of course, I came to Carrick here in the Caribbean in 1977 to set up the expanded program on immunization, and that was to immunize children and protect them against childhood disease such as diphtheria, pertussis, poliomyelitis, tuberculosis, and rubella. That program, as I said, started in 1977, sorry, and it continued until 1995 when I retired from here. By that time, we were able to eliminate poliomyelitis, and that was proclaimed eliminated from this Western Hemisphere. So I am proud to say that during my lifetime in the World Health Organization and PAHO, I experienced the satisfaction of seeing the eradication of smallpox from the world as one of the frontline fighters in the field, in the front line of the battle. And then I came to the Caribbean and we eliminated poliomyelitis from not only the Caribbean but from this hemisphere, the North, Central and South America and the Caribbean. And today we are on the verge of eliminating measles, rubella and congenital rubella syndrome. That report is being done right now by myself and a team, and I feel confident that by next year you will hear the report from the World Health Organization that these diseases, measles, rubella and congenital rubella syndromes, have also been eliminated from the Caribbean and possibly from this hemisphere, but certainly from the Caribbean. Thank you.